All right, let's talk about some hard stuff. The world of nursing encompasses so much. There is so much joy, there's so much grief, there's so much accomplishment, and there's so much just soul drainingness of this profession of being a nurse. And it kind of doesn't matter where you work, if you're bedside, if you're in a doctor's office, if you're in a school, if you are home health, infusion services, any outlet of nursing or wherever you're using your nursing degree. It's a tough job. I feel like every year they try to put more on the nurse, kind of just add another line to the job description, and it can be really draining. And when you are already spent, tired from life, whether it be, personal issues, family issues, children. I only have 2, and I know what that's like. When you're already spent and then you get this angry patient or angry family member, it can really throw you over the edge. So I want to talk about how to deal with that, how to talk to difficult family members, how to talk to combative patients, and how to talk to the really aggressive, confused patients. Because you will get them. Especially if you work in the hospital, you will see all of it. Let's talk first about the confused patient. I worked for a small stint, about a year, in an Alzheimer's and dementia unit, and the patients were very confused. A lot of them did not know where they were, what was happening, and it was actually a lockdown unit because otherwise they would just wander and escape and harm would come to them. So when these patients, especially when they're confused or they realize that they're confused and they're lost, they get very upset and angry, as everybody would. Confused patients, just let them talk. And if they want to talk about how they have to go to work, or they have to go vote for President Reagan or something, let them think that. Really confused Alzheimer's dementia patients, you don't really need to correct them. Let them think that it's 1964. Let them think that they're going to work. But if you need them to stay in a room or redirect them, kind of just distract them and redirect them. They love to help. So if you're asking for help, could you help me fold these towels? I have this baby that I need you to take care of. A lot of Alzheimer's dementia units have these pretend dolls that they look like real babies, and they love that. Can you sit and watch my baby just for a second? I'm going to go to the store. Just make up a story, and then they feel validated, they feel important, they feel seen, and holding a baby is like therapy, and it also keeps them kind of in one place instead of trying to escape or something like that. That works really well for Alzheimer's and dementia patients. Sometimes you just kind of have to redirect them, kind of distract them. Always do it calmly and respectfully, and don't put your hands on them, because that can bother a lot of people. A lot of cultures don't want to be physically directed into it. No, keep your hands off and kind of just, hey, come along with me, very calm. It really helps them feel safe if you come at them with anxiety, no, you can't do that. No, you can't go outside. It builds their anxiety. And Alzheimer's and dementia patients have a lot of anxiety because sometimes they do realize, oh shoot, I'm confused. Oh shoot, I can't remember anything. And that's a very scary thing. Never meet the anger with anger. Never meet the anger with frustration. Always give the person the time of day, because sometimes that's all they need to de-escalate. And this goes with combative patients, confused patients, or just rude and angry patients and or family members. Give them the time of day. Let them air out their grievances. Let them express themselves. Sometimes it's something that you can't solve. Let's say somebody's surgery was canceled and they've been NPO all day. How frustrating is that? I know what that's like. Sometimes they know that you as the nurse can't fix this situation. You can't open up another OR room. You can't bring the surgeon in from wherever they are, but you can listen to them. There's something very important that you need to learn in nursing, and you need to learn it early on, is to have a shield. Don't take on other people's emotions and energies and vibes. You need to be able to listen to them, be in the same room with them, and not take on any of it. So there's a balance between having a shield and being empathetic. Once you find that balance, it's very important mentally to say, I care, but I'm not going to take it. Like if you say that in your head, it kind of helps you get into that mindset. At least it does for me. I'm going to listen to them. Sometimes they just want to vent and complain. They get it out, and then you're good. Don't take those energies with you. If you want to visualize leaving that in the room, do that. Like, I'm leaving all of that negativity and all of those complaints and all of the anger in that room, and I'm gonna just brush it off and walk out and continue my to-do list or continue my rounds, whatever needs to happen next. But that's very important. Don't carry it with you. Combative patients, always ask for help. Call a code green or code gray, whatever you have at your hospital. Usually it's a code green or code gray for a combative person. If somebody is getting out of control, even if it's a family member that is just out of control, screaming, unsatisfied, and you feel a little bit unsafe, call it. Call it, and it really will put them in their place. Actually, my friend Natasha just told me a story about somebody who was just screaming and yelling and about things that are like kind of normal in healthcare, and they, some people just don't understand how the system works. So they called a code green on her, and security came and the DOE came and talked to her and said, you can't behave this way. You cannot behave this way, and put this person in their place, and it didn't happen again. Don't put yourself in danger or anyone else in danger. Just call the code right away. I do want to talk a little bit more about the ungrateful and difficult family member. A lot of people are going to lie about you. Sorry. Some patients and family members will complain about the nurse and say the nurse hasn't been in here for 30 minutes, and they expect you to wait on them hand and foot. With the difficult family members or the family members that are going to be disrespectful to you, you need to maintain a balance between demanding respect and maintaining your dignity. And then on the other hand, you need to be able to listen to them and give them the time of day. A lot of people are scared and frustrated, and they don't understand how the hospital works. And they don't understand how the system works. They don't understand your job description. They don't understand the tech's job description. They just don't understand the system. It's a different world. And when you're outside of that, it's really intimidating, and it turns into anxiety, and it turns into anger towards the nurse, because that's who they see most often. And if they feel like you don't have time for them, it multiplies it by 10. You can spend half an hour with a patient and not really give them the time of day, and they feel like, oh, the nurse was in here for like 2 seconds. But you can be in there for 5 minutes, give them eye contact, listen to them, kind of repeat back what they're saying, answer their questions. Actually ask them, do you have any questions about like your care or your doctors or the plan that we have for you? That's a really big thing. So if you're asking them something like that and making them feel like they matter, you can do it in 5 minutes, and they're going to say, this nurse is in here all the time. They're in here all the time. They're so attentive, just because you made them feel like they matter. So that's very important. You have a very limited time in each patient's room, especially if you have more than 3 patients. You have very limited time. I mean, there's only 60 minutes in an hour. Let's say you have 6 patients, God forbid, but I mean, in reality, most hospitals in med-surg or PCU or something like that, you're going to have 6 patients. That's 10 minutes an hour per patient. That's crazy. So you need to be able to do all your assessments, all your med pass, hanging IVs, taking them to the bathroom. I mean, anything that comes up, assessing them. It's needs to happen in 10 minutes, that's crazy. But if you bundle your care, do things all at the same time, make the patient feel loved, make them feel like they matter, like they're not just another checked box on your to-do list, like they matter, they are a person. You could do that quickly in 2 or 3, maybe 5 minutes, move on to the next patient, and they will see you as a very attentive nurse. So that is my comprehensive advice on how to deal with very difficult family members. You're going to encounter this even if you are the best nurse, or if you really don't give a and you're a terrible nurse and you just do it to clock in and clock out and get a paycheck. You're gonna have people complain about you no matter what. So accept that fact. Always make the person feel like they matter and listen, and then release that energy. Don't take it with you out of the room. Don't take it for the rest of your shift. Definitely don't take it home. What I like to do when I clock out is to visualize like those memory erasers from MIB. So as soon as I'm like swiping my badge to clock out, I'm like, it is gone. All of the negativity or stress or problems of the day, it's like, as soon as I swipe my badge and clock out, it's erased, and I'm not taking any of that home, because I don't deserve that, my family doesn't deserve that, and I want to have a life outside of work. So yeah, if you have any advice on how to deal with difficult family members, difficult patients, complaints, all of that sort of thing, I'd love to hear it. Go ahead and drop a few comments in the comment section below. If you want to know anything else about nursing, how to read EKGs, how to talk to the doctor, how to be confident in a code, I have a bunch of resources for you on my nursing blog. I will have a link to that below. I have a ton more videos. You should like this video and subscribe to my channel for more nursing videos. Have a great shift, guys. Bye!